Hi everyone, and welcome to today's video. I'm Mary Felling, JFB Myofascial Specialist and Physical Therapist. Today I'm going to show you an exercise technique that really is helpful to relieve headaches and minimize the return of headaches. Let's get started. I'm going to show you a technique today that you're going to be using. It's a technique that helps a bone in the cranium. It's a sphenoid bone. It runs behind our eyes. It's kind of like the shape of a bat. One end of the bone is here, it runs across behind the eyes, and the other end of the bone is here. I'm going to show you a very gentle technique that can really help give you some immediate relief if you've got a headache or migraine forming. So you're going to go to the corner of your eyes, the outside corner, and you want to go back about a half inch to an inch, just about that much, and you'll feel this little indentation. When you get back to that indentation, use two fingers. You can use one if you want, but it's helpful to use two fingers, and you're going to keep your fingers right in that indentation. That's the end of the sphenoid bone. You're going to sink slowly in. You won't go far. There's just not a lot of tissue here. And then once your fingers have sunk in, don't compress, don't push them in. Just honor how much soft tissue is there. And once they're in, holding that and without your fingers sliding over the skin, direct the pull forward. So it's go back about a half inch, found my indentation with my one finger, putting my other finger up there. And then I've sunk in, and now I'm directing the pull forward. From the side, it looks like this. I found the corner of my eye. I've gone back. Here's my indentation. I'm taking my two fingers. They're in the indentation. I'm sinking in towards my nose, and now I'm taking the slack out forward towards my eyes, away from my ears. That's the position you want. All right, if you need a moment, pause the video here, and for the rest of you, we're going to set the timer. So I've got my side, I'm in the indentation, sunk in, and I'm keeping my fingers sunk in without my fingers sliding over the skin. I've taken the slack forward. Timer has started. Keep your elbows as relaxed down as you can. Don't be out here. That's a lot of shoulder work. And this is a very gentle technique. Sometimes it's counterintuitive. How could this possibly help? Maybe I should really be tugging. No, don't do that. That might set you up for something else. It's very, very gentle. And as you're in this position, you might begin to feel some kind of a pull along the back of your head, the top of your head. You might feel it through your jaw. That's great. It's just telling you there's myofascial restrictions in the cranium in this area that are pulling through the rest of the cobweb down towards your TMJ or towards the back of your head. This is really good for taking the tension out of the cranium. And it's helping to align your cranial bones. Yes, just like any other part of our body, our cranial bones can get out of their natural position for a lot of different reasons. So in the JFB myofascial release techniques, it's always a minimum of 5 minutes in the position. And we stay a minimum of 5 minutes to produce something called the piezoelectric effect. The position your fingers are in now, you stay where you are. I'm going to take my hands away. The position that you are in now, using your fingers to take the slack away, as an elongation of the tissue. And after 5 minutes, that mechanical energy starts that electrical flow, that piezoelectric effect. And once that piezoelectric effect has started, it moves along the fascia, and it comes to those areas that are tight and bound down, dehydrated, glued, and thick together. Yes, we have fascia through our cranium, absolutely. And it helps them to soften, release, and elongate, and rehydrate. And when you rehydrate and release these fascial restrictions, it takes pressure off of all those little pain-sensitive structures in there, those little muscles. It takes the tension off of the nerves. It takes tension off the blood vessels, and all those things are pain-sensitive. So when you take the pressure off of pain-sensitive structures, you get less pain. And of course, like all myofascial release techniques, this helps the muscle too. Myo means muscle. So when we talk about myofascial techniques, we're talking about the muscle fascial complexes. All right, check to make sure your spine is nice and tall. You may feel this pulling back in your neck and think, oh, my neck is sore. I didn't even know my neck was sore. It may very well be you've got some fascial restrictions right where you're working that have created tension and stiffness through the fascial web back to the back of your neck. So while you're here, wherever else you feel this, if you do feel this somewhere else in your body, your neck, your jaw, top of your head, when you're done with this spot, move on to that other area and treat the other end of that fascial restriction tug. So since I feel this in the right side of the back of my neck, when I'm done with this, I'm going to treat the back of my neck. Go into all my videos. I do have some treatment techniques for that. I have a soft tissue treatment technique for the back of your neck too. Even though we're going to stop here at 5 minutes, I really urge you to continue to do an additional 2 to 3 minutes so you can feel some releases. A release feels like less pain. You may have some softening where you feel like your fingers are taking the slack out of where you are and your fingers are coming further forward. Those are all sensations telling you you've gotten some fascial release back there in this side between your fingers. So continue this daily for 14 days minimum. And if you're someone who gets chronic headaches, probably 4 weeks daily. And then once you start feeling better, then you can back off for maybe 2 or 3 times a week, do this. And this, you can use this as rescue medicine. Not only on days that you don't have headaches, make sure to do this to take care of the fascia so it doesn't begin to tighten. But also if you feel a headache coming on or you're in the middle of the headache, you can do this immediately to help relieve the pain. So I'm going to stop at the 5 minute mark that's coming up here. You guys continue on for another 2 or 3 minutes and then continue doing this daily 2 to 4 weeks. And after that, maybe 2 or 3 times a week to help maintain those changes. All right, everyone, thank you so much for showing up today. Let me know how this goes in the comments on my YouTube channel. And if you have anything else you'd like addressed, let me know that too. Thank you.